What happens if your body's master controller suddenly slows down? Meet the thyroid, the tiny gland governing your metabolism.
This gland uses iodine to produce crucial hormones, T3 and T4.
When your thyroid can't produce enough of these hormones, you have hypothyroidism, or low thyroid function.
Millions suffer, often misdiagnosed. Are you experiencing these subtle yet serious symptoms that are draining your life?
What does a chronic hormone deficiency feel like? It starts with your internal engine slowing to an unbearable crawl. Symptom 1, crushing fatigue. This is not just being tired. It is an overwhelming, non-stop exhaustion that sleep cannot fix.
Thyroid hormones regulate your cellular energy output. Without them, energy production plummets across all systems.
Symptom 2, unexplained weight gain. You eat normally, yet the pounds pile on easily, despite your best efforts.
Your basal metabolic rate drops drastically. Your body conserves energy by storing almost every single available calorie.
Symptom 3, cold intolerance. Are you constantly freezing, even when everyone else is feeling perfectly comfortable?
A sluggish, underperforming metabolism generates less necessary heat. Your body's internal thermostat is completely failing. Symptom 4, dry, flaky skin. The skin cell turnover rate slows down significantly, making topical moisturizers ineffective.
Skin hydration and repair relies on healthy cell function. Hypothyroidism literally dries you out from the inside.
Symptom 5, hair loss and thinning. Hair follicles need high energy for their rapid growth cycles, which is now missing.
You might notice hair loss, particularly in the outer third of your eyebrows. This is one of the most classic telltale signs.
Symptom 6, facial puffiness prep. This non-pitting swelling often targets the face, particularly the delicate eye area.
The thyroid controls the breakdown of complex sugars, which draw excessive water into tissues when they become unbalanced.
Symptom 7, brain fog and poor concentration. Your entire brain is starved of necessary metabolic and energy support. Thyroid hormones are critical for efficient neurotransmitter synthesis and overall cognitive processing speed and memory. You might find simple tasks require immense mental effort and often feel completely impossible to initiate or focus on.
Symptom 8, depression and mood changes. Hormone imbalances severely affect emotional stability and resilience.
Low thyroid can mimic major clinical depression, making antidepressant treatment ineffective until the true cause is addressed.
Symptom 9, persistent constipation. The pace of your entire digestive tract slows down to a near stop. Thyroid hormones directly influence the smooth muscle contraction necessary for moving waste through the body effectively.
Symptom 10, muscle aches, tenderness, and stiffness. Muscles suffer from incredibly poor energy turnover.
You may feel debilitating aches or cramps even after minimal activity because of the toxic buildup of metabolic waste.
Symptom 11, slowed heart rate tip. The heart beats less frequently and significantly less powerfully.
The heart tissue needs T3 hormones specifically to maintain its necessary contractile strength and efficient rhythm.
Symptom 12, high cholesterol. Thyroid failure impairs the liver's ability to process and clear blood fats. Without enough T3, the liver cannot efficiently clear cholesterol from the bloodstream, rapidly increasing heart risk.
Symptom 13, menstrual irregularities. Thyroid hormone control extends deep into the delicate female reproductive cycle.
Periods can become heavier, more frequent, or sometimes cease entirely, requiring specialized hormonal testing.
Symptom 14, hoarseness or voice deepening. This swelling in the vocal cords noticeably affects your pitch and tone.
Symptom 15, goiter. Sometimes the thyroid swells visibly in the neck as it desperately tries to compensate for failure.
What causes this failure? The leading cause is Hashimoto's thyroiditis, an aggressive autoimmune disease.
In Hashimoto's, your body mistakenly attacks its own healthy thyroid tissue, leading to progressive destruction.
Other causes include iodine deficiency, post-treatment side effects, or pituitary gland dysfunction, reducing TSH signals.
If these symptoms resonate, the critical next step is a simple blood test, the TSH, or thyroid stimulating hormone test.
A high TSH level usually indicates hypothyroidism. Your pituitary gland is screaming for more T4 that isn't being made.
Doctors also check T4, sometimes T3 levels, and look for thyroid antibodies to definitively confirm Hashimoto's diagnosis.
The good news? Hypothyroidism is highly treatable with simple synthetic thyroid hormone replacement therapy. Levothyroxine is a synthetic T4 that acts exactly like the vital hormone your body can no longer produce sufficiently.
Within weeks of correct dosing, patients often report rapid improvements in energy levels and overall mental clarity.
Watch for weight stabilization, improved skin hydration, and the welcome return of sharp, clear mental focus. Treatment requires ongoing monitoring. Dosing must be adjusted periodically based on consistent TSH blood readings.
Failure to treat hypothyroidism can lead to severe, life-threatening health consequences, including myxedema coma. Untreated low thyroid puts immense strain on the cardiovascular system, drastically increasing the risk of stroke and heart events. If crushing fatigue, constant coldness, and unexplained weight gain are dominating your life, do not ignore these signals. Talk to your primary care physician immediately about getting a full thyroid panel. Early diagnosis is key to regaining your quality of life. Stay vigilant about your internal health. Remember, your thyroid may be small, but its impact on your well-being is massive.